question is from Tom Korski from Blacklock's Reporter. Please go ahead.
Thank you, Dr. Tam. I have a bad feeling I'm not going to get my follow-up, so I'm going to ask two questions in one, if that's okay. A year ago, you had predicted less than 10% of the population would be infected overall. I'm quoting. That was widely criticized at the time, you recall. We see peer-reviewed data now that it's more 50, 55% more like it. So you must have 18 months worth of data. What is the percentage of the total population infected overall? My second question, a follow-up to CTV. I'm reading from the CMA Journal. I'm quoting Mark Johnson, a spokesman for PHAC in Health Canada, told CMAJ on August 25 that TAM wasn't taking interviews, but reporters could check back after Thanksgiving. CMAJ had also been trying since July to arrange an interview with NACI Chair Dr. Shelley Deeks about COVID-19 booster shots and vaccinations for young children, among other evolving issues. I'm almost done. Although NACI is an independent scientific advisory group, Johnson initially offered a PHAC official to speak for Deeks and later dismissed the interview request in light of the election. Dr. Tam, if you don't want to speak to reporters, that's your business. If you don't want to speak to the Canadian Medical Association, that's a big problem. What do you care if there's an election going on?
I think it is very important to speak to reporters, and that's why I'm here today. So, no, I think that's really critical, and we expect ongoing interactions and be able to answer your questions. And so that's really important. And we're still in the middle of an election, and we are communicating with you. I can't speak to the exact nature of the interactions with the CMAJ, but that's like another reporter as well. So I think we were trying to help in that manner. And NACI recommendations are published, and so we would like to be able to support any communications that would help people understand those recommendations further, for sure. In terms of, it's very interesting, your initial question, because I went back to have a look at our very initial modeling session and then the predictions. And I think we are pretty much bang on with everything that we had initially estimated. With all the uncertainties that this virus has brought us, we have several prevalence studies, and some of them are posted. We can send you the links. That some of them are done by the Canadian Immunity Task Force funded projects and working with StatsCan and other community surveys. And civil prevalence remains very low in Canada. And even if we had tested, of course, many people perhaps with mild illness and perhaps even asymptomatic don't get tested. But in a civil prevalence study, when you're studying the antibody to either the vaccine or the virus, we can tell the difference, and there are studies going on that shows that very small proportion of the Canadian population are immune, which is why we have to accelerate vaccine coverage. We don't have a lot of underlying immunity because the proportion of the population that are infected is actually very low. And it may be higher in certain pockets of Canada, but overall in Canada, the infection rates are very low, and that's why vaccines really matter as a safe and effective way of getting that immunity up.
Thank you very much, Dr. Tim. That concludes our press conference for today.